forum call. My name is Amy Gibson. I'm the COO with the Patient Centered Primary Care Collaborative, and I think we're going to have a really dynamic session for all of you today, and really hope that we'll get some great input from all of you who are participating, because we really rely on the diversity of our membership here at the PCPCC and everyone who takes part in these forums to really help guide the work of the PCPCC, because you're all an important part of that. So again, our goal today is to really introduce you to the Center on Outcomes and Evaluation, the leadership for the center, and to really, as I mentioned, solicit your feedback about the strategies that we're proposing and the objects that we've identified for this upcoming year and even for future years here at the PCPCC as we really move towards implementing patient-centered medical home and working with all of you to achieve that. So many of you on the call may know already that each of the centers had an opportunity to meet face-to-face at a retreat in January. And the leadership really came together to help craft and define their goals and objectives for each center. But we're still working on tweaking those and helping with the prioritization of those. And so we really want your input and allow you the opportunity to weigh in, and certainly want to hear from all of you today about what you're thinking and to give us that input and feedback about where we think we might be headed as an organization. So just to remind everyone that these calls for all of you to participate in our centers, not just the center, but all of our centers, are going to be held quarterly. And we're anticipating that our next round of calls will be in June. And again, we also provide information up on our website and a lot of different ways that you can stay informed about what's happening. But we're going to continue to provide you these opportunities to get your input and your feedback on what we're doing as the plan starts to take shape and we start to really execute on many of these tactics and objectives that we're going to talk about today. So you can expect many more communications from us, not just on these center calls in particular, but through our weekly communications, through our open forum calls, and most definitely at our conferences, and we'll talk more about that. So we have a lot to go over today, and I don't want to take up too much time giving all these more specifics about this, but I really want to talk to you about how you can engage in our work with us on the Outcomes and Evaluation Center today. So talking about the agenda, specifically what we're going to hope to accomplish today, we're going to give you this overview of our center and just remind all of you about the specific work that they're hoping to accomplish, a little bit about how overall center communications happen, and then I'm really going to pass the baton over to our co-chairs, Melinda Abrams from the Commonwealth Fund and Scott Van Valkenburg from Ernst & Young, and they're going to really help facilitate the discussion that we're going to have with all of you today. Let me tell you how we're going to get you to participate in this today. So we're going to take advantage of some of the technology that we've employed, but we're certainly going to try to make it as easy for all of you to participate in lots of different ways. So I'm going to go over the specific technologies, and certainly at any point in time you can shoot an email or a chat through the technology to just let us know that you're having trouble, and we can certainly try to get you participating in lots of different ways. So we want you to be active, and here's some of the ways that we're going to do this. We're going to actually allow you the capacity to do some voting. We're going to throw up several different polling questions, and you'll be able to actually go on your computer, click on the various options. And you might see an option that you like, you might see an option that you're not so crazy about, you might want to propose some additional ones. So in the ways that we can help you do that, again, there's the chat function, there's the question function that you'll see on the dashboard. We want you to also have the opportunity to talk live. Many of you might be listening through your computer, but if you want to actually talk to all the participants and the co-chairs on the call today, you're going to have to pick up a landline or your cell phone, and you're going to have to actually dial in. And then when you dial in, there'll be a PIN number that pops up, and you'll actually have to punch in that PIN number. So it'll be either star or pound function, a number, and then star or pound function, and then you'll be able to literally click on raise your hand, and we'll be able to get you live into the conversation and hear your thoughts. And we hope that many of you will take advantage of that as well. So after each of the polling questions, we'll open up the lines and have a chance for those of you who are on your phones, you'll be able to raise your hand and participate in that dialogue. Again, if you want to type in a question in the chat function, we'll be able to read those questions off. So Tara Hacker, who's our primary staff person for the center, will be reading those questions. Occasionally we'll get a question that comes in that's a little confusing to us, so if you can also get on landline too, or your cell phone and clarify if need be. That is also helpful as well. But continue to put those questions up. And we haven't had any problems getting through all the questions on each of these open forum calls, so that shouldn't be a problem. But if you have any questions about the technology or you're having trouble dialing in, you can send a quick chat, or you can also always send an email to me, and I can check on email as well. My email address, not just for this call, but for any other questions that might come up or suggestions after the call, you can send to agibson, agibson, at pcpcc.net. So let's get on to a little bit of an overview about our stakeholder centers. We've had several calls and presentations and lots of information up on our website talking to you about all of the centers. And I hope that many of you had an opportunity to participate in some of our previous center calls, open forum calls for the centers. This is our actual final. We saved the best for last. So we certainly want to talk to all of you today and get your input, even if you participated on a previous call. But just to kind of go over, so we have 5 centers. We have one for advocacy and public policy, one for care delivery and integration, one for employer and purchaser engagement. We have one for patients, families, and consumers. And then, again, we have the one that you're on today, outcomes and evaluation. Now, these stakeholder centers are really the incubators, the thought leaders, the experts, and the people who we're really looking to help drive the PCPCC core activities and programs. So we're going to talk about all the specific activities and tactics and goals that they plan to execute, how we've carved it out across all the centers, but there's certainly a lot of opportunities for collaboration across all of them. What many of you may not have had an opportunity to see on our website or be as informed about, but each of our centers is led by what we're calling our leadership cabinet. And that's typically 10 to 20 individuals that we really seek some more direct, regular feedback and input from. Most of our cabinets are comprised of members of our executive committee. If anyone on the call is interested in getting more information about how to join our executive committee, we'd be more than happy to talk to you about that, and there's certainly information up on our website. But we really do rely on our executive committee members and all the leadership of our cabinets to really provide this expertise and input into everything that we do here at the PCPCC. Again, having this opportunity to be an organization with a very incredible diversity of stakeholders and expertise and perspectives on the healthcare system, and particularly on how we implement patient-centered medical home, is so very important to us. If you have specific questions about any of the centers or how you can join or participate on those, you can certainly also contact Tara Hacker, who's our Director of Programs. She's on the call with us today. She'll be fielding a lot of your questions, but again, she's really accessible by email, and her contact information will be on the last slide, and I'll give it to you really quickly if you got any quick questions for her. It's thacker, THACKER, at pcpcc.net. So that's kind of an overview of our center structure and how we work on all of our programs and developing those here at the PCPCC. So our next slide is kind of about how we communicate everything that's happening out there to all of you in a really timely, efficient way. We know that you all have your day jobs, and every moment that you spend working with us is really hopefully helping you do your day jobs better, but we also know that you take a lot of time out of your day to really help us accomplish our goals. So we try to provide you lots of opportunities to stay up to date and provide you that timely information. So as I mentioned, each of the center on our website has a dedicated web page. You can access it through our homepage at pcpcc.net, and it really gives you lots of information about what's going on within each of our center cabinet meetings. It provides you updates on what we're working on, gives you links to a lot of our publications that are relevant to that work, and then we also try to put together a lot of resources from all of your organizations, knowing that we really try to disseminate and share all the great work that you're doing around patient-centered medical home as well. So if there's other information that you'd like us to share on those web pages, please let us know, and we'll try to get that information out to the centers as well. Many of you that have been involved with our centers had previously been receiving a monthly newsletter for each individual center. But just last month, we changed things up a bit because we were getting a lot of the same information to the same people. And so we're trying to do a better job, again, of being respectful to all the emails that I know you get every day. We all do. And consolidate that information into one newsletter. I think it'll also help with that cross-collaboration and coordination across all the centers so that you know what's going on in one center and how that might be complicating another center. Because, as you can imagine, each of these centers, nothing fits really neatly well into one center or the other. There's certainly a lot of opportunity and a lot of overlap and opportunities for collaboration. So you can subscribe to receiving that monthly center update through the center web pages. Again, you can also email Tara and she can get you on that list. Other ways that you can access that is through our social media networks, through both Facebook and Twitter. So lots of options to get communication from us. So hopefully you'll pick the one that works best for all of you. So our next slide talks a little bit about our overall center structure and how it fits into our larger organization. Many of you have been with the PCPCC since the early days, and you can see that this looks a little bit different than it had in the past, but we're really, again, trying to focus all of our efforts here on medical home implementation. You know, we did a really good job in the past of selling this idea, selling this concept, convincing people that primary care is really important to not only individual personal health, but it's also really important as a foundation as we work to transform their overall healthcare system. So you'll see how all the centers align and work in collaboration, certainly with staff and with our board of directors. And then as we have the need for specific areas to carve out some additional work, we might form task forces, we might develop particular publications on specific issues as we have in the past. We'll continue to do that. We have some special interest groups where people who have, interest in, let's say, behavioral health or medication management or e-health, that those individuals want to get together and develop some particular strategies or send some information that then will trickle back up into the centers. And then, of course, we have our event planning committee, and that's comprised of our executive committee membership that always does an amazing job of planning fantastic events that we have on a very regular basis. We partnered just recently. Hopefully many of you were at the Medical Home Summit in Philadelphia, a fantastic event, a great opportunity to network with all these individuals who are doing this work with us every day. So I think now is a good time for me to go ahead and introduce our co-chairs. I want to leave them plenty of time to get to the real meat of today's conversation with all of you. Our co-chairs for our Center for Outcome and Evaluation is Melinda Abrams, who's the Vice President, Patient-Centered Coordinated Care Programs at the Commonwealth Fund, and Scott Van Valkenburg, who's Senior Manager, Advisory Services from Ernst & Young. And they have been so fantastic in working with us and providing us incredible leadership, and really, especially for this center, because it is a brand new center with us, really trying to make sure that we're doing the best job at really addressing the challenges and the gaps as it relates to evaluation and collecting outcomes and sharing those around patient-centered medical home, but making sure that we're really mapping onto all the great work that's already being done out there, because we certainly don't want to be duplicative. So with that, I think I am going to turn it right over to our co-chairs and let you all take it from there. So thank you very much.
This is Scott Van Valkenburg. Amy, thanks a lot for the introduction. And first of all, let me echo Amy's thanks to all of you for participating today. What we're going to do now is some polling questions, and you're going to see a number of questions come up on the screen. Due to a character limit on the polling questions, some of the questions that will pop up on your screen will be abbreviated. So therefore, I'll announce the full questions and optional responses while you answer. So this one looks like it came up pretty good here. So we're going to start off by getting to know a little bit more about all of you. So please turn your attention to the question, and what is your current role in your organization? You can see we have research and evaluation, primary care clinician, government employee or official, work for a nonprofit, professional, or trade association, or work in a private industry or health plan. So if we could get some selections in and give everybody a few seconds to respond, so we'll show the real-time results in just a minute. All right, so if you look at the results, we've got some, let's see, I've got to move something here on my screen. We've got 43% that work for nonprofit or trade association, and 39% from the health plans or private industry. I'd actually like to know more about that, how it breaks down to find. I think so many people are now interested in consumers of healthcare, understanding the outcomes for patient-centered medical home. So thanks for all of you to call in today. Let's go to the next question. Why are you interested in participating in this call? And that'll be the next question. And the first one is to hear about how the PCPCC will gather the data on medical home initiatives around the country. The second, to hear about how the PCPCC will use medical home data to drive health system transformation. Third, have a dialogue with experts in the field. And four, learn how PCPCC will communicate PCMH value to stakeholders in the medical homes across multiple stakeholder audiences. So, or maybe it's other. Maybe there's another reason why you're interested in participating today. All right, so the main interest that brought folks here today, it looks like hear how PCPCC will use the data to drive transformation, as well closely followed by to hear how PCPCC will gather medical home data nationwide. So, yeah, thanks for that feedback. We hope, truly hope this call meets everyone's interest in learning about the Outcome Evaluation Center, and we look forward to your contributions today. Now I'll turn it over to Melinda to walk you through the center's goals and objectives. Melinda?
Thanks, Scott, and hi, everyone. Thanks for joining us. So on this slide, what you see is titled About Our Center, and in many ways it kind of summarizes the goals for the center, and they are to share data about clinical quality, about cost utilization, but I'd also say it's very much also about kind of patient experience and clinician and staff experience that can be collected from various medical home initiatives from around the country. A core objective of the center is to demonstrate the value of primary care and the patient medical home as a strategic and important, strategy to achieve and strengthen primary care so that we achieve high performance in our healthcare system. And finally, critically important and I think uniquely qualified, that this center as part of the PCPCC is to disseminate the data and the results that would enable us to enhance the awareness of the impact and the value of the medical home through a variety of convenings and publications and briefings and reports. So next slide. We are, while, that Scott and I were asked to co-chair this, and we are ably supported by Tara and Amy, we're really not doing it alone. There's a whole leadership team. It's a multi-stakeholder team. It's called the Cabinet, and each of the centers has one of this. And in January, the leadership, this Cabinet held a retreat, and we developed we kind of refined the objectives, which I'll about to get to in a second, and we kind of enumerated and brainstormed or outlined a set of possible activities or tactics to help us meet those objectives. And what you see here on this slide really is a representation of the breadth of participation that we have from a broad group of stakeholders. So moving on, though, to what these strategic objectives are. The first, and again, it's to fulfill, kind of fulfill those goals, is to obtain and aggregate and track and analyze information on the patient-centered medical home and its impact on quality, cost, patient experience, clinician staff experience, and as well as population health outcomes. And then once we have kind of collecting, tracking, and understanding this information, identify the gaps in the knowledge about the impact and the value of the medical home, And another, again, a key objective is disseminate the outcome data through a variety of venues and a variety of resources that could be tailored to specific audiences, because the information that might be most compelling to a state policymaker is different than the information that might be very compelling to a family or to consumer advocates. And one of the advantages of the PCPCC with its, kind of its breadth of stakeholders is that we really can benefit from the variety of perspectives and think about ways to meaningfully and appropriately and effectively tailor the message to those specific audiences. So what we did next, and after we kind of honed in on these strategic objectives, and we really would actually like your feedback on some of this, is one of the things we did at our retreat was we then brainstormed a set of activities or tactics that would kind of fill in or help us fulfill the mission of that objective. So here's what, and here's the result of these that activity. And for this is just related to objective number 1. So information, the collecting, aggregating medical home data. So, develop resources. So that's a little vague, but one that we felt like is important in terms of kind of thinking about developing resources. Another is conducting an environmental scan of the organizations, researching outcomes data, and highlight those partner resources on the PCPCC website. I'm sure a lot of you have heard Marcy Nielsen speak. She's very emphatically, she always emphatically states we're not trying to reinvent the wheel. We really want to partner with everybody. We want to make sure it's available on our website. So that kind of speaks to that. Like, who else is collecting data? What are they finding? Let's highlight it on our website. One of the ideas, and this isn't very specific, but we thought might be useful, is maybe to create a publicly available slide deck where, kind of outcomes from a number of studies or all studies, which would allow, so in some ways it would allow people to kind of download the PowerPoint or download the PDF and then use them for their presentations. The idea here is we would maybe create a template. We would have, we would collaborate with the authors or, whoever created that information, and there would be a source note, things like that, but it would enable people to kind of see and have tools so that they could share the information. The next bullet's a little bit different. It's about developing a spreadsheet to compare medical home programs. And so here really the idea is, while I could create a slide deck on a given study that would maybe have 3 different or 4 different slides about key outcomes, we all know that all the studies, they actually collect and report data in a different way. And so the idea here is that the spreadsheet is if we could actually, to the extent that we have information that's somewhat similar and common, you could look across multiple studies to see, for example, reductions in emergency department utilization, reductions in inpatient hospitalizations, improvements in quality, those kinds of things. Develop a database of case studies and best practices segmented by target audience. And then, very importantly, really find that the publication that Marcy and Tara and a bunch of people worked on, Paul, on the benefits of primary care medical home, that publication, that it be updated annually, because it really is such an important resource for the field. I think what's next is some polling. Scott, I'm going to turn it back to you to facilitate the polling.
Thanks, Melinda, for going over all the different objectives. So we're going to go back to objective 1, and the question to the audience is, what do you believe to be the #1 priority of the tactics you heard Melinda go over from objective 1? We have them here. So #1 is to conduct the environmental scan of organizations researching outcomes data. 2, to host a public slide deck, as Melinda explained, on the website with outcomes data. 3, to develop a spreadsheet comparing PCMH programs by core measures. The next would be to develop a database of case studies segmented by audience. And the final one was an annual update to the 2012 Benefits of Medical Home publication. So if people could select the one that they think is the #1 priority for our center to focus on, that'd be great. All right, to the second and third to be very close. We have the host the public slide deck, make that available for on medical home outcomes data, and the followed closely by developing the spreadsheet preparing PCMH programs by core measures. Great. So
great, because those are my top two favorite ones. Thanks, everyone.
There you go. Yeah, you probably were voting somehow. So what I'd like to do is go out to the audience and get some feedback from those who picked the first one, hosting the public slide deck, but to host a slide deck on the for make it available, and talk about why that would be something would be a #1 priority for you. Why that would be. So you know, I know we can take in, people calls or on the chat. Any thoughts about that? You know, and also as you're thinking about why that, in addition to why that's the #1, are there any other suggestions? Like, well, what are maybe some tactical things that may be very helpful for you? Well, you know, in how we do that. You know, how the decks would be available, how they would be organized. I know we had a lot of discussion at the retreat, brainstorming how that would look like and how we can make it user-friendly for people to access those slide decks. So, do we have any calls or any input?
No one yet. If you'd like to speak and you're on the phone with your PIN entered, you could raise your virtual hand and we'll let you chat. And if you don't and you'd like to type in your questions, we'll make sure to have your voice be heard.
In the meantime, we do have one question. It's not related to the tactics, but it's a question from George Patron on how the PCPCC leadership selected its leadership cabinet.
Well, actually, hold this thought, because George also has a vocal question. He can,
okay.
So he can ask it himself. So, George, go ahead.
Yes, hi. This is George. Actually, I've mentioned this in prior webinars we've had. I did select public slide decks that help the public know where the medical homes are and what the outcomes data are. Before this webinar started, I was reviewing legislation on the Health Care Act and so on providing mental health care. And again, I believe the country's trying hard to do something about access and so on for mental health. But the bills and all keep getting passed to build up more specialty clinics, community health clinics. They're important, yes, but they are specialty areas, and we don't have enough emphasis in this country on the primary care, on the patient-centered med home for all of the specialty areas to be coordinating with and integrated with, so that it's very important as I try to help people as a healthcare advocate and consultant to get good care. And I want to steer them to an operation that looks like, feels like, tastes like a medical home. So that's why I really think it's important for the host public slide decks that show medical home data. Thanks.
Thanks, George. I appreciate the feedback. Any other comments?
No,
and you said, is that, Tara, you said there was a question related to the center? That's from George about leadership? Or?
This is Amy. I was typing a message and sending it to everyone as Tara was reading it off. But yeah, just to clarify to everyone, so the leadership cabinet for each of our centers is comprised of our executive committee members. And our executive committee members are those organizations who support the PCPCC through annual membership dues. So again, if you have particular interest or want more information on how to join our executive committee, please do send me an email and I'll set up a call to talk to you more specifically about how to do that.
Thanks, Andy.
Sorry.
Go ahead.
If there was another question, I can hold off, but if not, I was just going to...
I was just going to say, go ahead, Linda. Why don't you go ahead and go to Objective 2.
Oh, before I do that, though, I just wanted to quickly respond to George's comment about kind of the value and importance of not just kind of making publicly available, easily accessible and digestible data, but also really the importance of the integration between primary care and behavioral health, and ways, and yes, there's a lot of activity underway, particularly in the Medicaid environment, particularly under, you know, the Affordable Care Act, Section 2703 in the health home, but really how, when we talk about thinking about kind of collecting the information and making it available for target audiences, I could see us having, you know, maybe, you know, being able to pull out the integration piece, like how do you connect with the rest of the neighborhood, or thinking about a state policy audience, not to say that not everybody's cares about the behavioral health, but because there's a lot of activity there, or incorporating it in that way. So I think there's a lot of flexibility with this activity to make sure that we address the behavioral health, primary care, and the capacity issue. Okay, so did you want me to move on?
Sounds great.
Okay, so the next, I think we're the next slide? Yes. Okay, so the next strategic objective is, you know, around identifying knowledge gaps. So the idea is in the first one, we kind of collect, we track, we analyze, we, you know, try to understand kind of the impact it has on quality and cost and patient experience. And then, but of course, you know, while collecting and understanding the impact, we're going to identify that there are gaps in knowledge. For example, let's just say, well, all of these studies, and lo and behold, nobody's looking at the impact on, you know, people with substance abuse problems, or people that have persistent mental illness, or whatnot. And so one of the ideas is that, you know, because we are going to be more of an aggregator and translator of information, kind of also use that as to identify some of the gaps. So in not only identifying it, but also the tactics might be, you know, to compare measures that are, one idea that came up was, you know, comparing measures that are really important to employers and crosswalk them to what measures researchers are in fact collecting. Because as a funder, I can just say, as a funder of a lot of research and a lot of researchers, you know, maybe what ends up in the peer-reviewed journal isn't necessarily what's top of mind for a benefit manager or, you know, a CFO at a large corporation. So kind of making sure that we're doing it to the extent that we've identified the gap. And here, I think the implication here was that there's not enough usable, actionable information for employers, that we would try to kind of bridge that gap and make it available to employers. The third, another area was to identify, you know, in light of finding the gaps, identify improvements to the model based on what we do know. So, for example, if we find that there's a whole bunch of studies that say, look, patient experience is moving in the right direction, but doesn't actually seem to be improving in the way that we had hoped or the way that we had planned, then kind of use together with the rest of the PCPCC and the other centers, kind of, you know, raise awareness to that issue, brainstorm about ways to make it better. You know, I don't know that it is necessarily the activity of the center to kind of come up with the solution as much as to kind of raise the issue, work in collaboration with the other centers and the staff to make sure that not only does the model improve, but also that the research, the future research, pays attention to that. And are we closing that gap? So that's really the third area. So the first is really more kind of identifying the gaps. The second is kind of bridging, particularly to employers, although we'd be open to other audiences. And the third is working across the other centers, as well, you know, on maybe one could say more on the advocacy or the transformation strategy, but also working with the researchers to make sure that they continue to monitor and follow that information to close the gap. So I think now we go back to a poll. Scott?
Okay, thanks. Yeah, thanks, Melinda. So we're taking another poll, this time on Objective 2, and what do you believe, again, to be the #1 priority of tactics from Objective 2? So we take a look at these. First one being identify the gaps in data and measures from being collected on medical home outcomes. 2, the crosswalk measures important to employers to those collected. 3, to identify improvements to the patient-centered medical home model based on peer-reviewed and industry-developed research. So if people could vote on that, that would be great. Or there's something in the other, and we'll take a look at if there's a different priority in this objective. I feel like Jeopardy, waiting the final round. Let's see what we got here. There we go. All right. So by a fairly wide margin, identifying the gaps in data and measures collected on patient-centered medical home outcomes, which was the first recommended tactic that Melinda went over. So again, similarly as we did with the first objective, taking a look at getting some input as to why that was the most important, or some things that would be ideas that the audience has on some tactics for achieving that tactic. What would some things that we would recommend? And are there, if there are people that didn't think that was the most number one, maybe there's something else they want to identify as an important gap or important tactic for identifying the gaps.
So we do have one comment from Sarita, and she says it would help if there's a correlation established between outcomes and incentive payments. Melinda or Scott, would you like to respond to that?
I agree. I think that I'm not. I don't want to read too much into the question, but I think two overarching issues are, that a lot of people have asked to some extent are, what component or which piece of the patient-centered medical home model is most highly associated with improvements in quality and reductions in cost, and payment, since payment's part of that important part of the model. I feel like that, it's like, so how much does the payment make a difference versus leadership or QI? I think the other corollary issue that often gets asked is, well, which payment model makes the difference? Like, which payment model is most effective, and what are the positive and negative unintended consequences? So the one thing I should just clarify as the co-chair of the center, we are not going to be the PCPCC, we're not going to be funding new research, and we're not going to be contracting for new research, or we're really going to be collecting and aggregating what's been made available. And I think that what your question and what's so valuable about this group and with this opportunity is the breadth of the stakeholders that participate. So we're really only going to be as effective and in our job as many people as join us. And so kind of asking questions like that help kind of say, all right, now let's go back and look at all of these studies that we've been kind of collecting and reviewing and analyzing and creating PowerPoint slides for. How many of them really kind of hone in and give us any information that's usable in any direction about the relationship between the payment reform and the outcome, and which payment model seems to make a difference? And we may find that none of them are actually doing it enough, and that could be a gap, and we could try to raise awareness about how important that is. We may not like the answer, but we don't have to get into kind of the reply at the moment. But so I think it's a great question.
We have another comment. Manisha, if you're actually able to talk, I'd love to hear you. I know you have a couple comments, and your last question was, do we need to delineate the specific outcomes? So you can, if possible, if you're on a phone, you can raise your hand and we can unmute your mic.
Yeah, if you could call in and put in your PIN number, we can make sure we can hear you for later. Maybe we can come back around there.
Sure.
Yeah, go ahead.
I mean, I'm happy to wait. I feel like, I mean, I was going to take a stab at kind of just having, kind of addressing the issue as articulated in the chat box, but I can wait. Or Amy, do you think I should just speak to it?
Go ahead and speak to it.
Speak to it.
So, there is, and I mean, I think delineating the specific outcomes, I mean, there are, I think we're at a point in the evolution of the medical home and the research about the medical home where we have reached some consensus on kind of broad categories and a core set of standardized outcome measures in certain areas. So in addition to co-chairing this center with Scott for the PCPCC, I also, in addition, separately, co-chair a patient-centered medical home evaluators collaborative, which includes over 80 health services researchers, and granted they're researchers, so it's not everybody who's represented here on this line, on the line, but, and really tried to say, okay, we have been funded to look at a number of evaluations. And what do we think the core domains are, and is there a common set of standardized measures that we should all be collecting and reporting so that at some point it's easier to synthesize and do some kind of meta-analysis to understand the impact of the medical home, because a lot of these demonstrations are small and the samples are small. And we did reach some consensus around a core set of cost measures, a core set of utilization measures, a core set of principles guiding the collection and reporting of clinical quality, and then also really, kind of reached some consensus about the value of the medical home CAPS, which is a patient experience survey. And I'd be happy to, through Amy and on the website and Tara, kind of make available a brief where the results of this 85-person group were reported in an issue brief by the Commonwealth Fund last May. That's not to say we're done or it couldn't be improved. I just thought I'd mention it.
Yeah, Melinda, this is Scott. If I could just comment also back to the question about correlating payment methodology and outcomes. I think another piece is starting to correlate integration of health plans and providers in terms of what resources are key in terms of data, analytics resources, technology for the practice, resources, care management resources. What are those key resources that we're starting to correlate with high outcomes? So, along with payment incentives, I think those resources in a integrated payer provider integration effort are important as well. So, I think with that we need to go to objective 3. So, Melinda? Sure.
So the third objective is really around dissemination. So we kind of collect the data, we identify the gaps, and then the third is we kind of disseminate the outcomes results for multiple audiences. And so the first tactic or activity is to widely disseminate, kind of available data that is then packaged and targets specific audiences. And I think in the Q&A it would actually be helpful to us here to hear from you what you think some of the key or top priority target audiences might be. The second tactic is around, kind of to the extent that we have a handle on what the data is showing about the value and some areas of improvement in the patient-centered medical home, that we work with and support the other stakeholder centers that are part of the PCPCC, and we support them in their dissemination efforts. And the third is to, use the information and disseminate so that key stakeholders are equipped with data and tools that allow them to sustain and spread the patient-centered medical home, so that it goes from kind of pilot or program to kind of a standard of care. And what do we think that those tools are? Who do we think those key stakeholders are? What's new and different other than slide decks and spreadsheets and briefings? There's other ways to reach them. And I think our group will spend a fair bit of time thinking about kind of the dissemination. So that's this area. Scott?
Great. Thanks, Melinda. So we're going to do another poll on this objective, and again, we'll go over these tactics for this objective, and ask you to select your number one priority of tactics. So the first is to widely disseminate the available data package for specific audiences. The second would be to support the other stakeholder centers in dissemination efforts, so identifying those outcomes requests that they have to support their work. The third is to equip stakeholders with data and tools that allow for further sustainability and spread of the medical home model. So if we could have people vote, and we'll take a look at that. All right, number 3, so to equip the stakeholders with data and tools that allow for further sustainability and spread of the medical home model. So 0 on the stakeholder centers. So, yeah. So if anybody wants to call in or provide a comment related to why that was the number 1 priority, or if we've missed anything as far as tactics to obtain this objective, that'd be great. Amy, do you have any?
One of the things that's nice, though, about the responses from the poll here is that, it just provides greater clarity about how to focus, because I think this area is still in need of further development. So I think it's good feedback.
Yeah.
We do have one comment from the audience that says, I think the Outcome Center could take the lead in developing a tool set, which could be used nationwide.
What do you mean by tool set? A tool set to improve the model, a tool set to translate?
For evaluation of medical homes.
Tool set. So meaning kind of like guidance on how to design a study, on the, kind of to do it the most efficiently and economically and resulting in the highest quality data? I know you're probably just trying to translate 60 characters in a chat box, but I would be more than happy. What I would say is it's a very compelling. Here it says, toolkit for implementation of best practices? No, for PCMH evaluation. I think that's a compelling idea and certainly one we could consider. So thanks. And I do think, just on that note, by the way, I do think our partners at the United States Agency for Healthcare Research and Quality, AHRQ, they have actually published a number of, briefs and white papers that try to provide guidance on program evaluation, on evaluation of medical homes. How big your sample size should be. What's important? Is it the number of patients or the number of practices? Well, it turns out it's the number of practices. Talking also about, kind of the importance of comparison groups and a couple of other things. I mean, some of them get somewhat technical, but they're very well written. They're trying to be as plain spoken as possible, and I'm almost certain that there are links to the medicalhome.arc.gov website on the PCPCC website, and they've really produced some top-notch resources, I think, that to help guide new researchers or new evaluators that are coming into the field.
So let's go ahead and go to the next slide, which is, I think we have a final polling question, Melinda, which we're going to take all the objectives. I think we have it here. Yeah. So what we're going to do now is we're going to have to choose the highest priority of tactics identified as the number one for, on all the objectives. And so we have 4 here. So probably because we had 2 that were close. Host a public slide decks. We know that was number 1 on the first objective. 2, to develop a spreadsheet comparing PCMH programs by core measures. And I think that was number 2 right behind that one. And then 3, to identify the gaps in data. And 4, we just talked about with equipping the stakeholders with data and tools to sustain and spread the model. So if we could ask the audience to vote on their number 1 for all the objectives, and let's take a look at that. And I have a comment, but I'll wait until we have the votes in.
Well, and I think the idea here is our limited resources. So if you pick your number 1 favorite activity for us to focus on, that doesn't mean we're going to ignore the others. You know, what would your number 1 top choice activity? Where, you know, so. Yeah,
there's your number. Melinda's probably happy.
No, I don't. I like all of these.
I know, same here. So, but so we see number 1 was the public slide deck, and number 2 being the equipping stakeholders with data and tools. And what I'm seeing from the polling today is the feedback is that, and we talked about this, Melinda, at our retreat, is that providing individuals and small practices, that, resources they can go on to quickly identify best practices, and they don't have to try and reinvent the wheel. Ways that they can, if they want to work on target populations, they have slide decks that can help them do that on how to do patient-centered medical home, and giving them data and tools to help sustain and spread the model, just how-to guides. And so there's a lot of people out there, a lot of people that understand the value of patient-centered medical home, but now they really want to understand tactics to do it. And so where can they go to get that information? And I think that's what we're hearing today.
I think what we're also hearing, though, is that people know that there's more and more information being produced and more information that's kind of being released. And so having a place to go to, right, where it's like almost like a centralized resource where you have access to the most up-to-date information that is reliable. So, it's been checked with the authors and whatnot, and that it's also very accessible. Kind of the bottom line of the study is told in 3 or 4 PowerPoint slides that they could then download and use with their stakeholder groups, whether it's consumers in their community, their boards, the physicians in their IPA or whatnot. So I also think that that's a very strong message, and then turning that into useful information to help sustain and spread the model.
Right. One of the things we talked about at the retreat, and I would love to get input, from the audience, offline, would be exactly some thoughts on how to make it as user-friendly as possible. We're talking large amounts of data. We talked about this retreat, being able to put it in a format that is it's user-friendly and easily accessible to what the user wants to get to on the website. So feedback on that would be great. So I think we have about another minute. I think while I think we're going to do a closing, Amy, you're going to do a closing, but while Amy's doing that, if anybody wants to chat in anything else that they think that we're missing related to the center our outcomes and evaluation center, if they'd like to pass in, that would be great. But I'll turn it over to you, Amy.
Thanks so much, Scott, and to you, Melinda, too. This was a great conversation. As Scott mentioned, if the webinar closes out and you didn't have a chance to submit your comment or suggestion or question, please do email those to us. Tara's email address is up on the screen now. We'll certainly share those with Marcy and our co-chairs and the rest of the cabinet. We really do appreciate your time and your feedback. It is very meaningful to us and really helps us as we, I have a small organization, and we really try to get the best bang for our buck and the reach that we can get, and to really consolidate all our efforts in a way that's really going to help drive all of your work forward. So again, thanks so much for your participation. There will be a short post-webinar survey that you'll receive right after at the end of this webinar. So if you could please take a few minutes to complete that. We'll also use that additional information to help shape future calls and to better understand how we can get you engaged and participate in all the work of the center. So again, if you have any questions about the center or additional feedback, please do contact Tara, and you'll be hearing much more from us in the days and weeks to come. So we hope that you'll continue to engage with all of us, and please do invite your colleagues to join these calls and to get on our communications list as well. So if there's others who you think that would benefit from this, please do share their information with us as well. So again, thanks so much to our co-chairs, thanks to the rest of the staff at the PCPCC, and we look forward to working with you all in the future. Thanks, everybody.
Thank you.
Bye-bye.
Bye.
The organizer has ended the session, and this call will be disconnected. Goodbye.